We're nowhere near the uncharted territory we were at in the spring. Nowhere near it. Nowhere. We are definitely dealing with a surge that we talked about throughout the summer and the beginning of the fall, and we're currently the largest per capita tester in the United States. We're doing somewhere between 80,000 and 100,000 tests a day. We were doing 2,000 or 3,000 tests back in March. And our ability to identify cases is dramatically better now than it was back then. As I said before, the healthcare system is far more prepared to deal with and to manage these issues now than they were back in the spring. We've been talking to them almost daily about what the best way for us to support them as we go forward, and we'll have more to say about this tomorrow when we talk about some of the field hospitals that we will reopen in places that will look relatively familiar, I think, to a lot of people. But this is a drill and a process that I think at this point we have a fair amount of experience with. And I think in many ways, this is not just an issue for Massachusetts. It's a challenge for the rest of the country and, frankly, most of the Western world. And there's a great story that just got posted that was in the Washington Post that talked about the fact that the vast majority of the spread that's currently going on, at least in the U.S., is dinner parties, game nights. It's the stuff I've been talking about for months now. Small, informal, casual gatherings with a bigger circle of friends than people were spending time with back at the beginning of the summer. And that is, in many respects, the thing that makes this so insidious, which is for us to really win this fight, people have got to recognize and understand that spending a lot of time outside their core circle, their core social circle, their core family circle, if people aren't going to wear masks, aren't going to distance, aren't going to do the things that they do when they're in school or at work or they go to the store or they go almost anywhere else, your risk and your opportunity, if you are infected, to spread the virus is so much higher. And that's the piece that people really need to focus on.